Continuing a special episode here of the Exam Room Podcast brought to you by the Physicians Committee with the weight loss champion Chuck Carroll. Joined now on Skype all the way from Beijing, Dr. Jia Xu. He is the author of Healing Without Medicine. That is a bestseller over in China, and he also happens to work with us here at the Physicians Committee. Welcome to the program, Jia.
Hi, Chuck. I'm happy to be here.
We are thrilled that you are here as well. My first question to you, frankly, is how are you doing?
Yeah, I'm doing well. I'm in my home in Beijing, and we are mostly in separation with the world. Everybody is like this, but things are getting back on track, and people are, the companies are reopening, and people are returning to work.
And we're seeing those reports here in the U.S., and that is definitely very encouraging as we seem to be about a month behind China, where you are, maybe 2 months even, and a few weeks behind Italy and other places in the world that are experiencing really heavy loads of the COVID-19 virus right now. When these reports started to come out of everybody getting sick there, you started to see the spread of the virus. At what point were you told to maybe self-isolate where you were?
I think it's at the end of January, about January 24th, something like that. And it's like all of a sudden that we are required to start to stay at home, and which is which we are okay. Yeah.
Well, I'm
Yeah.
glad to hear that. I'm assuming supermarkets and things like that they stayed open.
They stayed open. Actually, it's if you're not in Wuhan, you mostly fine. So the supermarkets open. You can it's easy to get food and everyday needs. So there's no panic.
Well,
Okay.
that's good to hear. I mean, was there
Yeah.
ever a level of really extreme anxiety? Because it seems like here right now in Washington D.C. there is extreme panic that's occurring, and certainly it's not just limited to this city. I mean, it's across the country. There's so much unknown. Was there a lot of anxiety in China at any point?
I think it depends on where you are. So in Wuhan, maybe because I'm not there. So, but I know that in that city, people uh, are more sort of restricted to where to their city. So they are not allowed to come out of the city, or people are not allowed to go inside the city. And also especially in hospitals, because there's so many people infected, and the hospitals there were basically flooded with patients, and a lot of people basically they have to wait for many hours until they get examined. So maybe just as well to stay home. Maybe it's better for the patients, for at that time. But now things are getting back on track, and the government have built two large hospitals with like thousands of beds just for this. So now almost every patient will get a bed in the hospital.
That's fantastic to hear. I know here in the U.S. that's definitely a big concern. Is there enough space in the hospital? They've called in actually two floating uh, big hospitals, big hospital ships. One on the West Coast, one on the East
Wow,
Coast, outside New York. I think each have roughly 1,000 beds and some
wow.
operating rooms that they're just trying to find space wherever they possibly can. Um, as this is expected to continue here for the time being. Let's
Yeah.
talk about just kind of the overall climate, because we know that these comorbidities, not just respiratory issues, but diabetes and other things like that, really put people at a higher risk for coming down with a severe case of this. Do you think that the culture will ultimately become a healthier one because of this, or are you starting to see the tide turn there as well?
I do see some changes, and people are talking more about plant-based diet, because plant-based diet is more anti-inflammatory, and if you already have some or some pre-existing conditions, which are mostly lifestyle-related issues and which are mostly pro-inflammatory. So if that kind of inflammation, on top of that, you have this new inflammation caused by the virus, then you'll have double inflammation in your lung, which will be much difficult for you to get through. So that's what is happening there. So a lot of people, like elderly and also those with pre-existing conditions, they are, more difficult to get through this.
It's you and I are so ingrained in the plant-based community. I'm wondering if the public at large over there is really kind of tapping into the idea of adopting a plant-based diet. Is that being more accepted over there, not just being generally healthier, but are they actually exploring the idea of adopting plant-based diets?
Yeah, because this comes from animal, it's like a bat or something. But so people are starting to realize that wild animals are not good, and they shouldn't touch it. But I think in terms of other flesh, farmed animals, I think people are thinking about it and talking about it, as I think that they have more awareness, but how much more than before, I don't know, but I'm expecting more people starting considering, at least eating more plants.
Well, let's talk about these wet markets where the virus is believed to have originated. This one specific to one in particular in Wuhan began with the bat. The bat infected an animal. That animal infected another species, and then another animal, and then eventually it gets all the way down to humans. And my previous guests, one an anthropologist, Wendy Orant, and then also having Dr. Neil Barnard on the show, both believe that there were restrictions put in place after the SARS epidemic in 2003, I believe, that would have really prevented this spread from happening here in 2020. Are those wet markets still open in China right now?
Probably not now, but after SARS, they did some restrictions, maybe in some local places or temporarily. But now this time they are getting serious, and I think there's a law just passed that banned all the wildlife trades. So basically, you won't be able to get one if you want.
Why are they so popular in China? What can you tell me a little bit about the cultural appeal?
Yeah, I can only guess. I don't understand actually, because I really don't understand why people would put any animal in their mouth because it's considered filthy, and they wouldn't, for example, they wouldn't touch a pig because they think pig is filthy. But why do they put their flesh in their mouth? That's mind-boggling. I don't know. But I think people want to try different things. They want to. I think there may be a culture thinking that if you eat a variety of different food sources, you'll get more enough nutrition, or you may get more, nutrients that can help you. And also, I think in the ancient times, only the kings, and they will be able to get all the meats they want. So maybe now everybody can they think they can be like a king. So that's why they try to they want to get whatever they can get their hands on.
You travel the country and you give talks on plant-based diets. By and large, are people very receptive to that message when you kind of explain the correlation between meat and inflammation and overall poor health? How is that message typically received even before this current pandemic?
Yes, as long as they are in my audience, then it's very well received because I think people are logical and they when they see the data, when they see the proof, the logic inside, then they say yes, this is what I should do. So that's why I feel that's why I'm very encouraged to in each time I'm giving a lecture, because there's so about half, at least I would say at least half of them will consider, trying the plant-based diet after each lecture. And the other half, I believe, even if they don't raise their hand, they will probably, reduce the amount of their meat intake. So I think it's very worth it.
So here in the U.S., we're seeing just an explosion of the number of people who are turning toward a plant-based diet. Is the same thing happening over there, or is it more of a slow and gradual type of build?
Yeah, I would say slow and gradual.
Okay, but it's trending upward nonetheless.
That's right. It's trending upwards. Yeah, but I think on this side, on this aspect, China is like 2 years behind. I would
Gotcha,
say
gotcha.
at least 2 years. Yeah.
So, what have you been doing to continue your work while you've been in self isolation? I would imagine at this point, a month and a half in, you got to be going a little bit stir crazy.
Yeah, actually, started people usually people send invitations to me, and I will line them up and go to different cities. But now people still sending their invitations, but this time it's mostly online. So I started to switch to online presentations, like just before you and me getting online. I just finished one online presentation to like 2,000 people, and talking about diet and sports, and it's a good topic, and a lot of people are interested. That's the good thing online, because people from anywhere in the world can in theory be listening to your talk.
All right. Well, just a couple more questions before we let you go. I mean, I really appreciate your time here. I know with the time difference, it's getting awfully late there for you. But what
You're welcome.
uh, the restrictions, I guess we may have already touched on this, but I want to hammer home this point. The restrictions that were put in place after 2003 for the SARS epidemic, they were lifted once the story died down, so to speak, and the spread was brought under control. Do you think, and this is just your opinion, do you think that we will see those same sanctions lifted here in 2020? Even though that these markets have already been outlawed, do you think that we'll see the loosening of those restrictions again?
I don't think so. I think this time they're getting serious. Because this time it is a law that's passed. I think last time it was just some local laws or some temporal regulations, but this time it's a nationwide law, I think.
All right. Well, that is definitely good to hear. And my final question to you is, when do you think you're going to be able to return to the States?
I don't know. I think it depends on both the situation here and the situation over there. So I have a visa that I can still extend. So here, so I planned to return in just last month, but I wasn't able to. So this time I hope I can get back in July, so that I can attend the the nutrition in medicine summit.
Yeah, I would love to see you there. I would love to sit down with you in person again and get a full update and then just really, kind of shake your hand and hope that all of this is
Yeah, me
behind
too.
us at that point.
Me too. Me too. It's very nice meeting you tonight.
The pleasure is all mine, my friend, and greatly appreciate your time and for you bringing us up to date on the situation over there. It's really heartwarming to hear about the progress that's being made and life returning to normal. That gives people here and in other countries who aren't there yet hope that they too will be there in time. Hopefully, not too distant of a future.
Yes, let's pray for it.
All right, my friend, Dr. Jia Xu, thank you so very much, my friend. You stay safe.
Thank you, Chuck. You too.
If you like that interview and you want more of it, go ahead and subscribe to this YouTube channel. Leave a nice comment below. And for the full interview, also head over to Apple Podcast and subscribe to the Exam Room Podcast by the Physicians Committee. New episodes with information and inspiration each and every Wednesday.